I want to do nursing, I want to do nursing is not always about what can the profession offer you. No, it's not always about, well, there's money or there's profit in nursing, there are opportunities abroad. No, it's also about what are you bringing to the table. Nursing is a big deal because the fact is that the life of a patient actually depends on what the nurse does or does not do. So it's a serious business, and there's always the question of what are you bringing to the table? Are you sure you have what it takes to become a nurse? Do you have the skills? Do you have the capacity as a person first to become a nurse? So in this video, I'll be telling you about the attributes that you really need to have, if you want to study nursing, if you want to become a nurse and do well in nursing, because part of what we do is to try to contribute our own quota to life, to the world, contribute in terms of making the world a better place. So when it comes to I want to study nursing, the question will always be, who are you and what can you bring to the table? What are the attributes that you have that can contribute to the well-being and the lives of patients as a nurse when you eventually become a nurse? Now, this is unfortunately Victoria. Watch to the end of this video and let us see, what are the skills, what are the attributes that you need to have in terms of characteristics and in terms of who you are as a person that can contribute to a successful nursing career. Now, there are so many attributes. There are so many characteristics. There are so many attributes that make life better for patients and for you as a nurse. Now, but in this video, I'll be telling you about 3 most important attributes that you need as a nurse, and I want you to put down some other attributes because there are thousands. There are many attributes that contribute that if you have that characteristics as a person and become a nurse, if you have that characteristics as a person and you eventually become a nurse, you're going to do so well in terms of contributing to the life and well-being of patients under your care. Now, with the first attribute I'm going to be telling you is that to become a nurse, you want to become a nurse, first of all, ensure that you are a caring and a compassionate person. I said make sure you're a caring and a compassionate person. Now, caring and compassion can never be underestimated in this profession because you will see people at their weakest points. You will see people at their lowest points. You will see people at their highest point. You will see people going through stages. You see people going through a whole lot as a nurse. So if you are not a person who is caring and who is compassionate, you're going to have difficulties in the profession. You're going to have difficulties relating with patients at that caring point because, look, nursing is a caring profession. It's a profession where you have to care for people. It's a profession where you have to get down and help your patient go to the toilet and help your patient and if your patient cannot go to the toilet, it's a profession where you clean up your patient, you bath your patient, you help your patient to poo, to wee, to those are just the ones I'm talking about. There are so many things involved in nursing because, look, you're taking care of an individual who may be sick or well, but however, the individual is seeking for health care service in one way or the other. And believe me, health is a big deal. In fact, health is a great deal. In fact, health is underestimated. The importance of health cannot be overemphasized. So as a nurse, you need to be caring and compassionate. And that is where we have all this, public view of nursing in Nigeria. But the public view nursing as people who are not caring, as people who are harsh, who are rude. Oh no. So we're beginning we that trend has been changing and it will continue to change. Okay? So nursing is a caring profession, and as such, anybody that desires to come into nursing must be caring and compassionate. That person must be able to care for other people at their lowest point, at their weakest point, and ensure that eventually they come out better out of their state. They come out of their state of ill health to a better health and to good health. Now, that's the first. And if you don't have these characteristics as a person seeking to get into the nursing profession, I suggest that, you take time to think again about nursing because it's all about caring for people. Now, secondly, you need to be a person that has empathy. Empathy is being able to put yourself in other people's position, being able to feel the pain of other people as if it were yours, being able to picture yourself in this person's position, and being able to render care and services as if it were you. So that's empathy. Empathy is needed in this profession. Empathy, being able to put yourself in other people's position, is highly needed in this profession. So you need to examine yourself, x-ray yourself, and find out, am I a person of empathy? Because to care for people as a nurse, you need empathy. You need to be able to put yourself in their position, because what we do as nurses, really, it cannot be paid for. The truth is that it cannot be paid for. And even if the public may not understand, even if people may not understand what we represent in this profession, especially in Nigeria, we who are in this profession understand. We understand that this profession, what we do, cannot be paid for, especially in terms of taking care of people as if they were ours, as if we are in their shoes. So what attribute, the attribute that is required at this point is empathy. Can you put yourself in other people's position and care for them, sacrificing what it takes to care for them as if you were in their shoes? And that is beautiful. I don't know, have you ever experienced a nurse care for you with empathy? Have you ever experienced an empathic nurse care for you? If you've done that, put that in the comment box below. Put down the comments in the comment box below. And please, if you've not subscribed to our YouTube channel, please consider subscribing so that you know when I put out awesome videos like this. And of course, like, and please help us share to other student nurses that you may know who may profit from this video. So yes, you need empathy. The last thing that you need, that I'm going to be talking about, because I said I was going to be talking about 3 attributes. Meanwhile, there are many attributes. I commend you and beg you to please put down other attributes that you think will be very, very vital, that you think that is really vital in nursing, or that nurses should have. Please put that down in the comment box below, in the comment section. All right, so the last one I'm going to be talking about is being able to problem solve, or being able to think critically and come up with solutions to problems. All right, so when patients come and they are under our care as nurses, we render healthcare services. Now, along the line of caring for patients, problems could arise, healthcare problems, psychological problems, other problems could arise. So as a nurse, it's important that you know how to critically and promptly analyze problems and come up with solutions to problems, because we don't have an ideal situation, we don't have an ideal circumstance all the time. You can be taking care of a patient and suddenly something comes up. As a nurse, you should be a person who is able to think quickly, think sharply, and come up with solutions to solve problems. That's having a problem solving ability, being able to critically think about the problem promptly and come up with solutions that can solve that problem. Because remember, the life of somebody is in your hands. So you will not be a person that takes a long time to think about a problem and takes a long time before you're able to solve it. No. You're a person who, you look at something, you already know, oh, look at what this represents, and you already know what the solution should be. So of course, there are room for improvement in all these attributes like I talked about. So I talked about, you have to be a person of care, you have to be a caring person and a compassionate person, you have to be empathic, you need to have empathy, being able to put yourself in other people's position, and you should be able to problem solve, to come up quickly with solutions to problems. Now, these are just 3 attributes. There are many attributes that make nursing profession interesting, nursing profession what it is, as a caring profession. So I need you to put other attributes down below, and remember that these attributes, you can build on them. You build on them as you continue to grow in the profession. We just put out this video so that you are aware that at least these are the basics you need to have as a person, characteristics that is peculiar to you as a person, then what will help you in the nursing profession. Thank you so much for watching to the end of this video. See you again.